Good morning. Well, the honor and privilege is mine, and I'm delighted to be here and to speak to you. I really note what you said about the contributions from patients. I wouldn't be where I am today without the support of patients who have run marathons, organized coffee mornings, and parties and things, and collected money for computers and research and other things at our both in Liverpool and in San Francisco. So thank you very much for all this. We hear a lot about patient-reported outcomes, which is a measure of, from our point of view, the success of treatment. You can get 20/20 vision or 6/6 vision, but there might be lots of pain or some other problem. And I know that the patient groups in the United States are very keen to measure patient-reported outcomes. And so I thought you might be interested to hear what kind of results we've obtained by measuring these outcomes and what we've learned from them. So in Liverpool, I did a study to see what patients actually felt after treatment for uveal melanoma. And we designed and the study involved almost 1,600 patients from England and Wales, and most of them completed several questionnaires over many years. So one of my data managers sent out questionnaires every month to all the patients who agreed to participate. There were about 100 a month, and each questionnaire had 70 questions, and she computerized everything. She was really busy, and she sent reminders if there weren't any responses, and it was very successful. So there's two groups of patients. There's patients who had the eye removed and patients who had radiotherapy, and we're comparing the two. Men were more likely to have the eye removed and women were more likely to have radiotherapy, but there wasn't much in it. The patients who had an eye removed tended to be older, and because many patients live far away from our hospital, once the eye was removed, we didn't see any need for them to keep coming back to our hospital every 6 months, like the patients who had radiotherapy. They kept coming back, but once the patient had an eye removed, then they stopped coming, so that we didn't have to incur lots of expenses for them. So this is a questionnaire that we designed, the European Ophthalmic Oncology Group, a long time ago, and I was involved in that design. And this is the kind of data I'm going to present. There's these two columns on the left, and the problems are depicted in black down below. So all you have to do is to see how tall the black column is, and you know how bad the problem is, comparing enucleation with radiotherapy. And on the right is a graph showing change over time. So for instance, patients didn't have difficulty reading because most patients were able to see out of the other eye. But and few patients had problems driving. But that's because many of them had stopped driving. This is one of the problems with these questionnaires. More problems driving at night, especially after removal of an eye. And there were difficulties with depth perception, pouring drinks, especially after removal of an eye, except after removal of an eye, the vision, this problem diminished over time, whereas with radiotherapy, because of late side effects, the problem increased. Same with walking downstairs, same walking in crowds, and so on. Patients had an eye removed, had a bit more discharge, watering, not much pain, whereas patients who had radiotherapy were slightly more likely to have headaches. Then there were worries about metastasis, especially soon after treatment, and then that improved. And then for some reason, later on, after many years, the worries increased. perhaps as patients got older. As you can imagine, patients were more likely to worry about tumor coming back in the eye if they still had an eye after radiotherapy. But surprisingly, there were some patients who were worried about tumor coming in the eye after the eye was removed. And so that taught us that we have to keep reinforcing messages to patients over many years, because they tend to forget. We tend to forget. I'm a patient too sometimes, what we're told. Few patients were worried about their appearance. Then we looked at anxiety and depression in these patients. And younger patients, as you can imagine, were a bit more anxious than older patients, but everything improved over time. Depression increased slightly over years, but not too much. Then we looked at functioning. Very good functioning after both kinds of treatment, good emotional well-being, good social well-being. Slight difference between the two with regards to the overall result, nothing much in it. This looks at our functioning, the functioning of our patients in comparison with North American patients. We didn't have data for British patients, but we had data for the healthy or the normal American population and the American cancer population. And the sort of quality of life of our patients was the same as the average North American general population. There was a slight dip with regards to emotional well-being, and that's because of concerns about future health, especially if they had a big tumor and were worried about metastasis and so on. Self-reported quality of life, very good. There were some patients down below, maybe about 15%, maybe about 1 in 8, reported poor quality of life. But then when we asked why the quality of life was poor, was it because of your eye? In most patients, the large majority, it was not because of their ocular condition, but because of other factors. And the quality of life depended a lot on social factors, on family support, friends, people who were living with, whether they were employed or not, general health, arthritis, bronchitis, other things unrelated to their eye. Whether they had the eye removed or not didn't seem to make any difference. And that's because after getting used to things over a few weeks, then there's a very good recovery. So in summary, I have learned from this, from my patients, that I can reassure patients that whether they have the eye removed or not, the quality of life is going to be good. They're going to recover and do well. You let me know if that's true or not. You know better than I do. So that's helped me to counsel patients before treatment. It's also alerted me to the fact that it's not just the patient, but it's the family and their circumstances, which are really, really important in the recovery and the coping and all of that. And I've also learned not to ignore the person sitting behind me in the clinic, the husband or the wife or the friend who's there supporting my patient. And we're so focused on patients, we tend to forget the other important person in the room. And I've learned to turn around and ask them how they are and to see what they had to say and so on. The next study was in the United States, where the Ocular Melanoma Foundation carried out a survey online, and then I was asked to analyze the data, and my colleague there, Dr. Afshar, wrote up the paper. So I had patients from all over the States, and they did something online, mostly women, and when it was men, it was mostly the spouse who had completed the questionnaire on their behalf. And this was very informative. Satisfaction with tumor detection, most patients were satisfied, but there were some who were very unhappy because they had gone to their optometrist or their ophthalmologist several times before their tumor was detected. And that really made them unhappy, either because their pupils weren't dilated or whatever. Tumor diagnosis, most were happy, but there's a lesson to learn that some patients were very unhappy that they were told that they had a benign mole, not to worry about it, and then after several years they went to see someone else who said, oh, that's not a mole at all, it's a melanoma, and it was biopsied and turned out to be a lethal melanoma, and they wish that the diagnosis had been correct years before, they had been watched for a long time. Treatment, most patients had plaque radiotherapy. Satisfactory treatment selection. Most patients were happy, but the slice in red indicates the ones that were unhappy, and we have to learn more from those than from the rest. Patients felt that they were told only about the treatment that was available in that hospital, and they wished that they could have been informed about treatments in nearby cities that might have been better for them, considering the size and location of their tumor. One big cause of unhappiness is the patients were not informed of the possibility of biopsy, prognostic biopsy, and then they went on the internet and they made new friends, and then they learned that their friends had a biopsy and they weren't even told about it, and they wished they could have had a choice, and then it was too late to do the biopsy, and that caused problems. There are some ophthalmologists who say, oh, forget about doing biopsies because it's only going to make patients unhappy. Whereas here, blue means good, yellow means unsure, and red means that the patient wasn't happy with the result. And the vast majority of patients were happy that they had a biopsy, even if there was a bad result, a bad prognosis, because they were empowered to deal with their condition. Screening for metastasis. Some patients were unhappy because they didn't see an oncologist who knew about uveal melanoma, but they saw a general oncologist who did totally the wrong tests and stopped following them up just when they needed to start being followed up. So really important to see an oncologist who knows about uveal melanoma. Information is power. Some patients complained, there's about a quarter of them, that they just weren't given enough information. When they asked for information, they were told to Google it or something like that, which upset them, as you can understand. Psychological support. Half patients were unhappy that they didn't receive enough psychological support, and it's really, really valuable. I've worked with a psychologist in my team for many years, and the feedback I've received has been really, really good. So there's a psychologist I worked with in the United States, and her approach was to help patients to appreciate all their assets, all the benefits that they already have, like relatives to support them, good health, lack of other conditions, and so on. And so we learned a lot from her too. So to try and improve things, learning from this, I set up a Bill of Rights for patients with uveal melanoma, so that patients will know what standards of care to expect, to be informed of everything possible, everything that's useful, to have a chance to ask questions, to have emotional support, all sorts of things. And these are standards that we try and adhere to. But I'd like to finish by saying that empathy is really important. It's really important for us to understand our patients, and this has really helped me and my colleagues to understand patients and patients' needs and so on. I've learned so much from my patients. But empathy works both ways. And it's helpful if patients could understand their doctor. And I'm saying this because in Britain, there's a problem with Ocumel UK that's raising patients' expectations beyond what is possible in normal hospitals. There are certain things that can be achieved because of good luck or whatever in some places. And it's good to try and raise standards to those centers of to the levels of those centers of excellence. But when that's not possible, for reasons beyond the control of the doctors or whatever, then when patients' expectations are increased excessively, that causes conflict between patients and the doctors looking after them. And I've seen that happen, and that's a negative outcome for both parties. So please try to understand the people looking after you, and if you're nice to the person who measures your visual acuity or who the receptionist at the desk, they'll probably be really nice back to you, and that will help you and help them and so on. I saw that happen in the States when patients were nice to the staff in the front desk and so on. The staff in the front desk really improved their performance, became much more enthusiastic about their work, and the whole service was uplifted by the good feedback from the patients there. So thank you very much.